It's also really thinking through prevention or how do if I'm coming in, I'm a bright student. There's a lot of pressures then in coursework. I find that they don't take advantage of many of the things that would help to mitigate some of the stress, the anxiety that they're having. They'll be more efficient at being a student if they can take some downtime and actually engage with some of these other things that I see and others see as part of a holistic look at our own well-being.
That was Dr. Chris Holstege, Senior Associate Vice President of Student Health and Wellness at the University of Virginia. We had a fascinating conversation about student health and wellness, talking about UVA's journey to a more holistic, collaborative, and proactive approach, and what other institutions can learn. What struck me from this conversation is that so often people think mental health and they go right to more counseling. And while that may be needed, it's so much more than that. I think you're really going to appreciate this, so let's dive in. Welcome to the Connected College podcast. I'm your host, Elliot Felix. I've helped more than 100 colleges and universities change what they offer, how they operate, and how they're organized to enable student success. And if you're a leader in higher ed and you think that the silos and separations get in the way of student success, then this podcast and the Connected College are for you. We're here to learn and work together to bust silos, question tradition, and forge partnerships so that students feel connected to their college, their community, their coursework, and their careers.
Mental health plays such an important role in student success, and I'm delighted to hear from you today. And I think a great way to get started is to hear how you did. So tell us a little bit about how you got started in higher ed and do all the great stuff you're doing at UVA.
Thanks. Got involved in the University of Virginia in 1999. Came here as a young faculty member in the School of Medicine. Started what's known as the Division of Medical Toxicology, taking care of poisoned patients or overdose patients. I did my training in emergency medicine after medical school and then my fellowship in medical toxicology. And 2013, the executive director of student health at that time was retiring. And Pat Lampkin, who I think is just a phenomenal leader, as previous vice president of the University of Student Affairs, they asked if I'd come in the interim to take a look at student health and wellness, at that time, just student health, and what things could be done to enhance it. I pulled data, very data driven, compared with our peers, universities, presented to the Board of Visitors, and we had a lot of dialogue about where we should enhance what we're doing for services for students in this arena.
What were some of the findings from that about what you were doing well, how you compared?
So University of Virginia's student health at that time had really four main entities under its roof. And one was CAPS, known as Counseling and Psychological Services, where the mental health services are provided. One is Medical Services, which is the biggest unit. One is the Student Disability Access Center, where all the accommodations occur. And then the fourth is the Office of Health Promotion. It's doing the prevention efforts. And it's a multi-collaborative group. And our goal was to really work as a multi-collaborative team holistically for the student. And that group has grown significantly. And what we saw initially was we were really behind our peers in regards to clinical services provided, space. And then one of the things that's starting to evolve was how do we look at, again, the holistic student, looking at it as a multi-collaborative team and wellness. And presented to the Board of Visitors, who said, we're a top tier university. We're not looking to be average. We're actually looking to excel. And the donors got behind it. We had an anchor donor to actually help start the building process. The university put in, and then other donors came forward so that the students didn't have to incur the cost of a new building. We enhanced funding for personnel. It's not all about the building, but it's also making sure we have the personnel.
Right.
And as you can imagine, Elliot, there's tremendous debates. For example, mental health services, what do we provide in-house and what would be referred to the community? And really, we should be providing the majority of the services to our students. One, because there aren't many mental health services in the community, and it's not fair to take those services away from our 25,000 students or so. The other is our mental health providers really know the university well, the pressures that the students are under. And so we really enhanced CAPS, the Counseling and Psychological Services, We also enhance medical services. We have more students who are traveling abroad. We really want to invigorate our travel clinic. A lot of students are coming in now with allergies and then expanding our allergy clinic. And then we have students, thankfully, because accommodations are given that actually do have some pretty significant chronic medical issues that we also want to make sure we have top providers who are caring for. And then we certainly work with UVA Health on when we need to refer. And then for accommodations, we had a really limited testing facilities. And the new building really allowed us to expand and have top of the line testing facilities too for students who need accommodations. And then finally, the prevention activities, the Office of Health Promotion, you can imagine really important with this demographic to assure that there's appropriate prevention activities in education and health. And then as time went on, became more apparent that we really need to talk about wellness and well-being. And how do we look at those things? And that's really a big initiative now as we start moving forward. We've really provided a lot of services when we talk about the mental health crisis, but how do we get it early on so that we're not getting to the point of a mental health crisis? And what things can we do and what can we do in a multi-collaborative fashion there too?
First of all, thank you for taking on all that with your colleagues and garnering that support. And I think in that story, there were some key ideas about collaboration, a holistic approach, promotion and prevention, wellness. And I'm curious how those like factor into how you define student success.
I do define it as part of that. If you think about our students coming in, when it comes to health, it's a multidisciplinary grouping, right? The medical providers and medical services associated with our counselors, associated with our case managers, associated with our accommodation specialists. They're really multidisciplinary teams that are working with the students as they navigate the university or have certain needs. It's also really thinking through prevention, or how do I, if I'm coming in, I'm a bright student. There's a lot of pressures then in coursework, a lot of pressures of, for example, if I'm a pre-health student, I'm looking at graduate school. How do I navigate that in a balanced fashion? And what I was seeing with some of my students, give my medical students as an example, because I was teaching this morning to the medical students, I find that they don't take advantage of many of the things that actually I personally think would help to mitigate some of the stress, the anxiety that they're having. For example, a lot of our fourth year medical students don't know what Old Cobble Hall is and doesn't know there's music and there's free music. You can just step in. And I don't know about you, but when you're here, for me to go listen to music at Old Cobble Hall, really talented musicians on an evening, and then walk out and see the lawn on an evening night, kind of soft sounds, a lot of pressure comes off your shoulders and it puts life in perspective. The other thing we realized is our students aren't getting out and enjoying the environment. Again, my fourth year medical students are rotating with me, and I'd ask the question, how many of you have been to Shenandoah National Park? And very few. It's 30 minutes away. They all have cars for the most part. Or just around here. Have you gone down the hiking, some of the trails? There's some beautiful places just to get out in nature. Exercise is another one. We have the fitness centers. There's a lot of different club sports that are out there. There's, if you look at the various clubs as CIOs, huge opportunities. Pretty much anything you can think of, there's a group out there that's doing it that you can get together and engage. And so we're looking at this that when students come in, really focused on their careers, their academics, but also on their taking time for themselves too. And I personally think they'll be more efficient at being a student if they can take some downtime and actually engage with some of these other things that I see and others see as part of a holistic look at our own well-being.
I think that holistic approach is so key because I think a lot of people they hear, mental health and they jump right to CAPS. But what you're laying out is those services are a part of it in the right space to deliver them in. But it's music, it's the outdoors, it's the environment, it's exercise, it's student organizations, it's finding your people in these places. It's all those things. I love it.
It is. And I think we have an opportunity again, some of the research that we're doing right now in the student health and wellness realm, that we can actually research this too. So we're making sure that we're making good use of resources. Some of the donors have given money towards this initiatives. They certainly have in regards to the building, but also some of the research that we're doing. And I'd really like to see in the next decade that we're helping to lead some of the research, especially in this demographic with the student population, which I think we can then actually take some of what we've learned and extrapolate then to high school and middle school students too. To look at this a little differently, I'm a toxicologist. I don't like giving medications unless we have to. The answer is not giving medications to many of these. And I'm afraid we're in a society that people want a quick fix.
Right.
And I think the clinicians at times, and I have a son who's an intern in psychiatry, I have a sister who's a psychiatrist. There's time certainly for giving certain medications, but there's many other ways to mitigate mild to moderate depression, anxiety, that I think we need to look at too. And then also trying to educate as the students are coming in early on in their careers that some of these other opportunities exist so that it isn't all driven academic success. But I worry as a toxicologist and some of the things that brought me in, people are trying to mitigate that with other things. It may be medications, pharmaceutical, or it may be I'm smoking cannabis, maybe I'm doing alcohol. Those are not the answers that we want. That's not a good response to the stresses. There's much better responses.
And even if you do these things together, even if you're even if there is medication, right? Like exercise is part of it, right? It's never any one thing.
You know, for mild mental health aspects, exercise still tops up there to help actually mitigate. I give Barbara Freed a lot of credit, one of the donors that started the Freed Center. Now that gets into exercise and functional exercise, where we have physical therapists and then students who've been trained to work with students on appropriate exercise, which I think is an important part of our health. And we're now integrating that in as kinesiology is in the building too. They certainly have a lot of interest in this. We're doing a lot more with with UVA Rec, which is fantastic. They have outdoor clubs. They're trying to get more engaged. We had referrals from CAPS for exercise and physical therapists to try to mitigate too, which I think are all great programs.
So it sounds like in terms of the big kind of shifts in that you all are trying to make as you address mental health, it's leaning much more into the proactive health promotion and prevention and leaning into a holistic approach where it's not the quick fix, it's not one thing, it's many things working together. Are there other big things that you see like coming down the pike that keep you up at night as you think about student mental health and that are going to require us to think differently or act differently?
This mental health crisis is not slowing, it's actually escalating. We're going to have to look at how to mitigate that and what are the causes for it. A lot of different thoughts on how to mitigate it. And so that certainly keeps me up at night because we will be inheriting more of the stress, anxiety, depression based on what we're seeing, unless this starts to resolve. The other is I do have a lot of concerns, but I'm a toxicologist of the substance use. We're seeing a little bit of an upswing in alcohol use post-pandemic with decriminalization of cannabis. That's being used more, which has some of its own problems. Hallucinogenic agents are being decriminalized now across the country, and that's starting to bleed in, and we've had some adverse consequences. And so I am concerned about some of the substances that are coming into society for our students too, as they look to mitigate this a different way. I think it's really important for us to look at things that we can do, such as good sleep, good nutrition, exercise, outdoors, and getting enough outdoors, getting other things that actually are relaxing to you, whether that's music, other art forms, sports. There's a number of things I think that the students should be engaged with. Now that I don't know about you, I've got a busy career, but I certainly find time to go hike in the mountains, to listen to music, to play with my kids, grandkids. It's about carving out time. And I think I'm much more efficient when I work, when I do have some of that time carved out. Yeah.
Yeah, I think that's like time management skills, are not only valuable to make sure you get your paper or your project on time, but I think that like maybe that's going to play an even larger role in students' lives so that they can create the time and be more balanced, as you're saying. That might be one of the unlocks for some of these other activities.
And go back to the research, we really need to study this. And it's another big initiative that we have is to actually study what we're doing as we're interacting with the students to see if the outcomes are different. There's challenges in that, but we don't want simply anecdote that seems to help. We really would like to show that
Mhm.
there's definitive studies that some of this works. There's some good work that's coming out with this. And my hope is to, in the future, lead in this arena at the University of Virginia. We've gotten the space. I actually have the research and some grants right now. And I think we have some good potential to get some good data here to help too.
Yeah, I had the good fortune to work on the Contemplative Commons, and I know part of that is a research agenda, right? Where you're like, before someone's doing yoga or movement or meditation, you measure cortisol before and after, and you start to, this is my cursory understanding of a complex subject, but you start to understand like the impact of certain activities on stress, and that kind of research I think is really great because there's so many people that are pushing, an evidence-based approach to student success in the academic arena. I think it only makes sense that you'd apply the same approach to mental health and wellness. What are some of your favorite examples at UVA or elsewhere of programs that do the kinds of things you're talking about, where it's proactive promotion and prevention, and it's a holistic approach, and it's not defaulting to caps or medication as the kind of only answer?
Yeah, and I think, for example, Dartmouth, it's a much smaller university, does a great job of orientation of getting the students involved with the outdoors and what's out in the outdoors around the area. I wish we could with all the incoming students. So that we do have a formal partnership with Shenandoah National Park, for example. We're looking to
Hmm.
expand on that. They've been good partners. We have a joint website right now. We are expanding and plan to expand on the website areas for where there's great trails where the students can talk with each other, things that are adjacent to grounds where they can easily just walk off or within an hour's drive and I can get out to certain hikes and such. And I think there's some groups that do a very nice job on that. So it's one example of the outdoors, for example. There's been a few examples out there. It's not, how do we look at exercise and fitness as we're looking at the functional exercise right now? Some of the areas that we're looking at are a bit limited though, right? The data hasn't been, I wouldn't say the programmatics of the data has really been out there in this demographic group, primarily because so many people have been so busy on the back end providing the services, after they've had anxiety and depression, as opposed to really trying to address it on the front end. And I think that's where we actually can be pretty cutting edge because there aren't a lot of programs out there. I do think there's some data out there, and some of the data that's out there, it's always challenging, and we've been talking about this and some of the initiatives that we want to move forward. Um, the biases that come in when you do the initiatives, right? We want to make sure if we do an intervention, can we really tell at the results that they're valid? And I think that takes a multidisciplinary team too. And we're talking about that again. I'll go back to the outdoors. We're talking about that with the outdoors. If we were to do initiatives to see getting the students more engaged with the outdoors. If we got the students engaged out there, had transportation out there, would that make an impact? What about those students who are working with IM Rec in the outdoor programs? Does that help to mitigate? But it's always hard matching cohorts. I'll just put that out
Yeah.
there.
It sounds like you could keep the Office of Institutional Research and Assessment busy forever on understanding the efficacy of the various interventions you've got going.
Yeah, and we have a very complex database right now directly with student health where we can actually track in a de-identified fashion some of the students as they're flowing through. And again, that's one of the big initiatives we have is the research arm of this.
Are there any promising early results or things that have surprised you or?
One thing that worked really well, I think, in the mental health realm and the decreased barriers is embedded counselors in the schools. So still part of
Hmm.
CAPS, but we embedded counselors and we started with a law school first, and then kind of expanded out from there. And that's worked really well because then the counselor becomes part of the community of that school. And it's easy for students just to pop into the office and say, hey, can I talk to you? Which is in mitigating issues before they start to escalate. And so we saw huge jumps in utilization And I wouldn't say extreme cases, but it was just good utilization and talk. And the first one in the law school was also a lawyer, really knew how to communicate with the law students. I think did a phenomenal job there of launching that program. And that's worked well in all the other schools to help mitigate some of this early on. That makes it easy for the faculty to stop in and say, hey, this one student is having some problems. Would you mind talking with them? As opposed to taking them across grounds to student health. And that also takes away some of the stigma too, if I have someone who's embedded right with us. So I think we've had some tremendous success, one, enhanced utilization, and I think earlier interventions that have occurred with those embedded positions. We just embedded someone with a Student Disability Access Center in one of the schools too, for the same thing to help with accommodations. Early interventions as opposed to letting things really get extreme where they have to come into, for example, the emergency department at the University of Virginia Health.
In our last couple of minutes here, you're learning these great things about embedding counselors. How do you learn and where do you go to learn about what peer institutions are doing to understand what's working and what isn't for them? Or what are your go-tos for that kind of learning?
When we first looked to build the building and expand our programs, we actually did a tour a lot through the South, but also through the United States as we were traveling to look at some peer institutions. So you can imagine the ACs did a driving tour and stopped at them all. We visited Duke, UNC, Georgia, other schools, and tried to bring back some of the best practices that we thought and aspects of the building. And you're absolutely right. Right now, part of it is visiting where we think, for example, talking with Rutgers, who has enhanced intensive outpatient programs for students where they're hard to find around UVA. Do we look to expand in that area? We just started recovery housing for students in recovery. And there's Texas actually has
Houston,
some.
University of Houston has a great,
yeah. So it's trying to see who's got some of the kind of seen as some of the top programs in the country to emulate. And then certainly at the national meetings, we have our various national meetings. We try and get our team members to the American College Health Association, various director meetings occur for the various units. And then certainly we talk with our peer institutions here in the Commonwealth too. There's some unique things that William & Mary is doing, Virginia Tech is doing, George Mason University, and we're all trying to learn from each other on what are the best things that you're doing and what are you trying to expand on.
I know I look at the National College Health Assessment every year, and that's my kind of benchmark for 1/3 with an anxiety diagnosis and 1/4 with depression and so forth, and what the various stressors are. It sounds like checking out the conference proceedings of the American College Health Association would be good too.
There's different data streams that we look at. The counseling directors, for example, have one data set. There's a number of them that are out there.
Thank you so much for your insights about a really important topic and the progress you're making and where we should go next together. Appreciate it.
No, thanks. Thanks for your interest. Great to talk to you.
Thanks for listening to the Connected College podcast. Subscribe to my Connected College newsletter at elliottfelix.com for insights and excerpts from my upcoming book, tools you can download, and special offers. You can also find more information about talks I've given, articles I've written, and upcoming events there. And please support the podcast by rating and reviewing it wherever you're listening. Let's create connected colleges where students will succeed.